As COVID-19 hospitalization rates surge, the U.S. blood supply has become dangerously low, prompting the Red Cross to declare a national blood crisis for the first time ever. Right now, some blood centers are reporting less than a day's supply of certain types, forcing hospitals to postpone major surgeries. Last year, the Red Cross saw a 34% decline in new donors. Newsy national correspondent Meg Hilling with more.
As if packed ERs with COVID-19 cases weren't enough of a problem, hospitals are now grappling with a blood supply shortage unlike anything the American Red Cross says it's seen in over a decade.
It's actually the first time ever that the Red Cross is declaring a national blood crisis. It's the lowest amount of blood we've had on hand in more than a decade. And, you know, that's due to a number of factors.
Supplies now running desperately low.
We are challenged to collect enough blood to meet hospital needs, and sometimes up to 25% of a hospital's need might not be met.
The American Red Cross supplies 40% of the nation's blood supply, and they say they need folks with every blood type to be donating ASAP.
Every 2 seconds, someone in the U.S. needs blood. And if we don't have certain types on hand, especially O, which is the universal donor.
The American Red Cross says donations have dropped by 10% since March 2020, and that some hospitals may now only receive 1 out of the 4 blood products they need. Part of the problem, fewer blood drives at schools and colleges. In addition, health officials say they're having to explain that donating and receiving blood is still safe.
It's very safe to donate blood right now. You cannot contract COVID from blood donation. You can't even contract COVID if you were to get a blood transfusion from someone who has COVID. It's a respiratory virus, and respiratory viruses are not transmittable through blood donation.
With January being National Donate Blood Month, American Red Cross officials say there's no better time to start donating than today. And to sweeten the deal, the American Red Cross is now offering donors a chance to win Super Bowl 2022 tickets.
We encourage everyone who is healthy and feeling well to roll up their sleeves and make an appointment. We require masks of all of our staff and our donors and anyone associated with a blood drive, so the donation process is very safe.
Meg Hilling, Newsy, Chicago.
All right, joining Morning Rush is Dr. Claudia Cohn, Chief Medical Officer with the Association for the Advancement of Blood and Biotherapies, to explain why the blood shortage is so problematic for our country, especially right now. So what exactly is causing the supplies to be depleted, and what types of blood is needed the most?
So the blood is being depleted for 2 major reasons. One is we're seeing staffing shortages. Just like every other place around the country, there aren't enough people to staff the blood centers, collect the blood. The second reason is donors are tired. People have been through a lot in the pandemic, and they just aren't coming in the numbers that we are used to seeing. Some of that is because we can't hold blood drives anymore, as was said already, in schools and businesses. This is where we went to the donors to collect the blood. Now the donors mostly need to come to us.
So I want to give you Oh, I'm sorry, go ahead.
Sorry, we need every kind of blood. Group O is universal, so it is the safest to give to a patient where we don't know their blood type, but we need every kind of blood possible.
So I want to give you a scenario. Let's say somebody got COVID, right? How long should they wait after that diagnosis or after they're done experiencing symptoms? How long should they wait to then donate blood?
They have to be asymptomatic. They need to be healthy to donate blood. That always was the case. If you're asymptomatic and have a diagnosis, wait 2 weeks.
Okay.
Just so that you don't spread COVID to anyone else.
So let's kind of walk through this now and explain to our viewers what will happen, you know, if this blood shortage continues. I mean, we hear about it when there's hurricanes, other natural disasters, that people should go and donate blood just in case for those emergency situations. But in a situation like this, what could happen?
Not to be melodramatic, but patients will die. If you're anemic, you need to have blood delivers oxygen to your organs. And if you don't have enough blood, then your organs start to get damaged. So if you're anemic, don't have enough blood, you're going to have a heart attack. You're going to have a stroke. Your kidneys will shut down. Your liver will shut down. So patients absolutely need blood every day. As someone on the Red Cross said, every 2 seconds, someone needs a blood transfusion. People with sickle cell anemia will go into sickle cell crisis if they don't have blood to replenish their supply. It's dramatic how much blood helps people and how easy it is to donate blood, and it's necessary.
Now, when we talk about this, we have to talk about the hospitals, right? And we know that they are so overwhelmed and have been really since this pandemic started. So how are they dealing with this shortage? I mean, and that impending kind of feeling that this could get worse?
Well, hospitals are struggling because of staffing shortages, because of so many COVID patients, particularly unvaccinated patients. And it's very, very difficult for a hospital to have to turn away a patient because they don't have a bed, or not treat a patient as they should because they don't have the blood. To have to make the decision who gets the limited amount of blood that's available is a terrible decision that doctors have to make now every day because of this blood shortage.
Yeah. Dr. Claudia Cohn, Chief Medical Officer with the Association for the Advancement of Blood and Biotherapies. Thank you so much for your time this morning. Have a good one.
Thank you for the interview.
Absolutely.